This is case of the week. I want you to take a look at this x-ray and tell me what's wrong with it. This is a patient of mine who had a history of a bimalleolar ankle fracture, who ended up getting an ORIF of the fracture. And you can see she's got two medial malleolar screws here, and here is a neutralization plate. This is an interfrag screw, and these are screws holding the plate in place. Do you see anything that looks not quite right with this hardware? This is the AP view. I'm going to go ahead and show you the mortise view. The mortise view is where we can see the joint and make sure that the mortise is not widened. And take a look at this hardware here, and take a look at this hardware in this area, and tell me if you think anything looks wrong. Now I'm going to go ahead and show you a picture of the lateral film, and I'll just tell you on this lateral film, you can't see a whole lot that I want you to be able to identify. This patient definitely has a loose screw. Every once in a while, I'll run into a patient with a loose screw, and this one completely has a loose screw. I'm going to have you take a look at the x-ray because it's really important that you get 3 views of the x-ray. I'm going to take you back to the mortise view, which is where we have the foot internally rotated about 15 degrees, and you can see the foot rotates in. See where the screw is protruding? You can't really appreciate it very well on the AP view. I'm going to scroll back to the AP view, and you can see it protruding a little bit, but not nearly as well as you can on the mortise view. It's really important that you get 3 views of an ankle, AP lateral and mortise view, because one view may not show the pathology at all where the other view does. So just make sure you get all 3 views. If you have somebody that has painful hardware, such as her, where the screw is backing out, that hardware is going to need to be removed. So I'm going to get her on my OR schedule to get her medial malleolar screws out. While I'm in there, I'm also going to get her lateral hardware out because she's really thin and she can feel the plate and the screw heads on the fibula or lateral side of her ankle. So everything is coming out, so that should take care of her problem.